A move to contain malaria. The Ministry of Health is set for massive distribution of 2 million bed nets across the country. The cross-border initiative, in partnership with the Senegalese Ministry is commencing on the 8th of May, coming after the commemoration of World Malaria Day on April 25th. Meanwhile, GRTS has been examining the government's stance in the fight against the disease. Alajimbai has the details.
Preventable and treatable disease that continues to have a devastating impact on the health and livelihood of people around the world. Over the last couple of years, according to the WHO, malaria has caused over 500,000 deaths, more than two-thirds of which occurred in children under the age of 5 in African countries. The manager of the National Malaria Control Program, Balakande, spoke about the commemoration of World Malaria Day.
Last week, on the 25th of April, World Malaria Day was commemorated by all the African countries, of course, throughout the world as well. The objective was like in 2000, African head of states met in Abuja where they committed themselves to reducing the malaria burden by half by 2050, and also making sure that malaria is also reduced to a very minimum level. In order to honor those commitments and also to remind the African leaders of their commitment, that is why World Malaria Day is commemorated once every year, and in addition also to raise awareness, so that people will know actually malaria still exists, malaria is a threat, and everybody has a role in malaria control and in the fight against malaria.
Despite the high prevalence and death rates of malaria across the African continent, the Gambia, according to Mr. Kande, has made significant gains in reducing malaria infections.
So I'm very, very happy to tell the general public that malaria has been really reduced very significantly over the years. Let's say from 2010, the malaria prevalence was only 4%. Then in 2014, it was reduced to 0.1%. 0.2%. But now, most recently in 2017, the prevalence of malaria is 0.1%. So you can see over the years, we really have been reducing the burden of malaria and also the prevalence of malaria over the years.
The Ministry of Health, through the National Malaria Control Program, has developed initiatives to reach people at risk of malaria with the services they need. Mr. Kande explains.
What we have been doing over the years and what we will continue to do is distribution of bed nets. We've been distributing bed nets, in the health facilities and even at community level, free of charge. On the 8th of May, this Sunday that is coming, we're going to launch a bed net distribution campaign. It's going to be launched in Amdalai, jointly together with Senegal, because we intend to distribute over 2 million bed nets. In addition, we've been also giving children under 5 administering SMC drugs in order to prevent malaria complications. In addition to that, we are also spraying houses, especially in URR and CRR, to reduce the malaria burden and also the density of mosquitoes or the population of mosquitoes. Also, we have been giving, there are effective and efficient drugs that are available in all health facilities. And we also have to make sure, RDTs, that is for malaria diagnosis, to test whether somebody has malaria. So we have all these things, all those facilities available at community level and even at facility level.
Kande thanked government and its partners for providing the resources required in the fight against malaria. He, however, warned that there is no room for complacency. Alajimbai, GRTS News.